All right, the election is over. The economy is tanking. What we're talking about today is depression, and it might be something that may or may not be affecting you, but still, we've brought some folks in who are going to try to help us deal with all of these issues and talk about the new Center for Depression at the University of Louisville. Dr. Jess Wright and Dr. Alan Tasman with the University of Louisville. First of all, congratulations on your new center, the Center for Depression at the University of Louisville. It's a national effort to lift the depression departments at universities. Tell us about that.
Right. The U of L Board of Trustees, of course, affirmed our center, and we were very pleased now to have full U of L designation. But we're even happier that we've been invited to be one of the founding members of a national network of depression centers. We're in company with such places as Harvard, Stanford, University of Pennsylvania, University of Michigan, and this will allow us to really do an even better job of providing cutting-edge treatments, research, and education for our community.
And we were talking about the University of Louisville Center. What kind of community outreach are you going to have? How can the community take advantage of the expertise that's there in your center?
Jean, we're developing programs that spread throughout the community, but are primarily centered at the U of L in our new office building at 401 East Chestnut Street, where we have a really wonderful facility that we can use to help people with depression and other related problems like bipolar disorder, anxiety disorders, and so forth and so on. The community can reach us by just calling us, and we can do consultations. We can develop treatment programs. We can offer, as Dr. Tasman mentioned, cutting-edge treatments. What we've emphasized above all is to do what we call evidence-based treatments, treatments that work. So if you come to the center, you can be reasonably assured that the treatment the doctor would prescribe would be something that would be very beneficial to you. Depression is so common in our community and throughout the nation and throughout the world. About 1 out of 5 people suffer from this problem sometime during their lifetime. So it's so common that it's almost in every family, in every community, in every workplace. And we need to do a whole lot better job of treating this. That's why we set up this Depression Center at the U of L and why we've linked to the National Network of Depression Centers.
We actually have some numbers to show people. You're absolutely right about depression. It really is prevalent. You know, as Dr. Wright said, 1 out of 5 Americans experience depression in their lifetimes. Depression costs our nation more than $80 billion a year, and 30,000 suicides a year are a result of depression. Right. Yeah, we're going to give you a number, so have a pen handy. We're going to give you a number to the Depression Center in a little bit. So let's just talk about that, okay? Right now, you know, regardless of who you supported in the election, there are a lot of disappointed people out there, a lot of people who are afraid. And considering the stock market and job losses and things, there's kind of a psyche in the United States that just may not be all that healthy. What do you do? What do we do?
Well, I think one thing is to recognize that job loss and problems at work can cause family problems, and those are among the highest kinds of stress that people can face. I think the other thing that we want to make sure everybody knows is that depression and related kinds of problems are very treatable. We have a very good success rate. So I think helping people to not only get control back of their lives and help their families do that, but also to treat depression if that's going on in the family or any individual in the family.
And people should not be afraid or hesitant to reach out. Dr. Wright, you and I have talked about the fact that there are certain groups of people, for instance, African Americans even, and especially African American men, who are less likely to seek help for depression.
That's right, Jean. Unfortunately, there's still a stigma about depression and similar problems in our country, and it sometimes gets in the way of people getting treatment that need it. That's another reason why we set up this Depression Center, because we want to get the word out there that depression is a significant disease. It's a problem that can be treated and should be treated. It's a disease just like any other problem, like diabetes or hypertension or cancer. And that's why these kinds of initiatives really need to be done. In many ways, the Depression Center is patterned after cancer centers. If we go back a generation, there was a much greater stigma to having cancer, and we didn't know as much about how to treat it, and we didn't have all the research that's been going on. It's been so strong. It's helped cancer be something that there's much more hope to treat that now. And so we need to do the same kind of thing with mental disorders like depression.
I have to tell you, we, Dr. Wright and I talked a lot after 9/11, and we were experiencing the same kind of community psychosis, if you will. And you wrote a book called Getting Your Life Back, which was very helpful to folks in just doing exactly what it says, getting your life back. What are some of the things that we can do that are proactive to make us feel better?
In this current situation where we're having a financial meltdown, yeah, I think I've had to be my own doctor a bit in the last few months.
Yes, we have.
If you look at your retirement plan, it can get pretty depressing, can't it?
Lose sleep.
Right. Well, what I've been trying to do in my own life, and I'd recommend to other people, is trying to keep centered on the things that really are meaningful in your life, to not weigh this financial problem as the controlling factor of all of your feelings, all of the way that you see your life and how it's going. You know, so many other things about our lives, our families, our spiritual connections, if we exercise or we have hobbies or interests. Those are the kinds of things that in a sense we can control or we can invest in. And in tough times, I think it's even more important to keep that balance and to be involved in lots of other things other than worrying about the stock market or worrying about what might happen in your workplace.
Okay, and keep us grounded. Thank you very much for coming and talking to us, and we'll be in touch. We'll have you frequently on this show because I think we really need both of them.
We look forward to it.
All right, thanks so much, and have a pin. We're going to give you more information about the Depression Center at the University of Louisville. For more information, you can call the U of L Depression Center of Excellence at this number, area code 502-813-6634. Coming up, we'll get to the bottom of our back trouble by focusing on your feet.